Hi there, my name is Zach Felix, and for my final project, I will be talking about how to be a safe and effective nurse. The goal for the quality and safety education for nurses is to meet the challenge of preparing future nurses who will have the knowledge, skills, and attitudes needed to improve the quality and safety of the healthcare systems within which they work. So we're going to be discussing quality and safety that nurses provide for patients. We're going to discuss communication and teamwork, patient and family-centered care, evidence-based practice, quality improvement, informatics, and patient safety. All right, communication and teamwork. Communication, I believe, is key to success in a lot of areas, and this definitely applies to nursing. Nurses wear a lot of different hats. They're an advocate for their patients, meaning they have to talk to the patient, they have to talk to the provider, they have to talk to pharmacy, they have to talk to physical therapy, and um, just a bunch of different aspects of the patient's care. And the nurse needs to be effective at communicating with each of those different areas so that the patient can get the care that they need. Um, there are multiple factors that can influence if communication is effective. One is that the communicator needs to be clear, they need to be precise, they need to um, help the recipient understand what they're saying, and the recipient also needs to understand what the communicator is saying. A simple example of this is somebody asking a question. The communicator needs to have a clear, precise question. Otherwise, the recipient might think they're asking a different question or making like a snide remark or something like that, and it can just cause a lot of issues if the communicator isn't clear. Um, Effective communication can help resolve conflicts. It can also help build trust in the healthcare setting. Teamwork is also important in nursing because it helps promote patient safety and it helps reduce patient stress, which ultimately helps with better patient outcomes. Effective teamwork gives each member of the team a voice, and everybody can express concerns or um, ask questions if they need help understanding. I think that's important because somebody might recognize something that other team members either missed or overlooked during their um, time with the patient. And teamwork can help build professional relationships. It can help people feel like they're part of a team, not just a nurse caring for a patient, which I think is an important part of healthcare. Patient and family-centered care. I think it's important to remember that we care for patients, but we also care for family members of those patients as well. Patient and family-centered care is an approach to the planning, delivery, and evaluation of healthcare that is grounded in mutually beneficial partnerships among healthcare professionals, patients, and families. I think focusing on patients and families will help us include culture, values, beliefs, um, support system, and patient preferences when we provide patient care. And I think a lot of times patients don't really feel heard by healthcare professionals. They're just seen as like a condition that they need to cure. I think that including all of this will help the patient feel more more like a person and not like a number. And I think that will go a long way. Evidence-based practice. This is a process used to review, analyze, and translate the latest scientific evidence. The goal is to quickly incorporate the best available research, along with clinical experience and patient preference, into clinical practice, so nurses can make informed patient care decisions. We have been learning about evidence-based practice our whole time in nursing school, and I think it's important for us to continue to utilize it as we step into the nursing field and use it throughout our career so that we can provide the best patient care possible. Quality improvement. Quality improvement is the systematic approach that is guided by data to improve the quality and safety of healthcare delivery. I think anytime that a nurse is participating in focusing on patient safety, they are contributing to quality improvement. They don't necessarily need to be part of a study or a research group to help in this area. An example that I think we're all familiar with is urinary catheter infections. First, we need to identify situations that lead to the problem. So obviously it's going to be when somebody gets a catheter inserted, but are there other factors that are common in situations where urinary catheter infections are present? We'll need to ask questions like, was a catheter really needed? Was the catheter in for more time than it was supposed to be? And was the catheter inserted using sterile and aseptic technique? Finding answers to these questions and other questions that we might come up with can help us find common denominators that can help be improved, which will improve quality of patient care. And it'll prevent future urinary catheter infections from occurring. Informatics. So healthcare is jumping on the technology train. There are a lot of things that are different in healthcare today than they were, say, 10 years ago, thanks to technology. And one of these things is the charting systems that hospital systems and healthcare practices use to keep patient information. It makes it easier for patients to sign documents and have those documents saved for future reference if needed, such as a living will or a power of attorney. And having all of these documents and charting systems through technology, so they're available to anyone on the healthcare team, makes healthcare a lot more streamlined, and I feel like it prevents things from being done over again if they don't need to be. One example of an informatics tool that can be used to promote community health is mandatory reporting of infectious diseases. For example, the monkeypox that's been going around recently. This helps promote community health by knowing which diseases are prevalent, and it can influence safety practices such as who needs to be educated about how this disease is spread, what can we do to prevent the spread of this disease, are there vaccinations that we can give to the public so that they can have less susceptibility to contracting this disease, and so forth. And the big one, patient safety. I feel like patient safety is one of the biggest goals of nursing. I can't count how many times I've heard the words patient safety since I've been in nursing school. There is a possibility for human errors when we're doing cares for our patients. So I think it's really important to follow policy and procedure guidelines every single time. And I know that it can be kind of tedious, but it will help patients have safer experiences in healthcare. An example of this is when preparing to give a medication to someone, a nurse could be distracted by, say, another nurse or another patient, like in the hallway or something, and they could leave what they're doing for 5 seconds and come back to it, and then either do something over again or skip a step, and this could cause an error in medications or in any kind of nursing procedure. So I think it's important to do tasks one at a time so that we don't have this problem. There are a couple of terms that I wanted to explain a little bit. Just culture is a system of shared accountability between organizations and employees. Employees are accountable for their decisions, but they're also encouraged to report errors and vulnerabilities so that improvements can be made so those errors don't be repeated. Fairness is where all employees are treated equally in similar situations, like not showing favoritism or being unjust with different employees. Accountability is when each person is accountable for the choices and decisions that they make. And error reporting is when an error is reported, when an error is made, it's reported promptly and accurately, which will promote effective interventions to correct situations where errors occur. And this is just a list of the references I used while making this presentation. In conclusion, I would like to suggest to always stay on top of what is happening in nursing and striving to be a safe nurse, somebody who practices safely and participates in efforts to promote safety and quality so that patients can get the care that they deserve and so that we can be the best nurses that we can be. Thank you.